At a recent Covered California forum at San Diego State, you could have heard a pin drop. That's because there were only 3 students in the audience. Nonetheless, presenter Jan Spenceley went through her entire PowerPoint routine.
So we're here to talk about today Covered California and making connections to health or making connections to health coverage. And hopefully those two things are synonymous.
Spenceley directs the nonprofit San Diegans for Healthcare Coverage. She tells the students that without health insurance, one accident could saddle them with tens of thousands of dollars of medical bills, and that would ruin their credit.
You don't get a phone on your own, you don't get a apartment on your own, you don't buy a car on your own if your credit's messed up.
After the presentation, graduate student Charlie Griggs says when you're in college, health insurance just isn't a top priority.
But school's a pretty big responsibility, so kind of trying to change the focus and move from doing homework or one thing to moving over and trying to take care of the health insurance. It's easy to put that on the back burner.
Spenceley says students are a tough sell. They think they're invincible.
And I don't think they realize that you're healthy until you're not. And that's not the time to get coverage. Or if you have any kind of an active lifestyle, including getting up and walking across the street, riding your bike, riding your skateboard, surfing, walking, going up and down stairs, something can happen.
Under Covered California, health insurers can charge higher premiums based on age. Still, on average, the premiums that older adults pay don't fully cover all of their medical expenses, whereas with young adults, the premiums they pay more than cover their expenses. That's why, for the system to work, more young adults need to be enrolled. Students in the Cal State system are not required to have health insurance. Even so, at San Diego State, students must pay a health fee of $175 per semester. That gives them access to a full array of primary care services at the Student Health Center, including radiology and prescription drugs, all at little or no cost. But SDSU social worker Irma Murphy says there's a catch.
We don't open after hours, so they're not going to be able to see someone if they're sick in the middle of the night. They'll have to go to an off-campus urgent care center or emergency, and we don't offer that. We don't have urgent care either.
In Covered California's first year of operation, more than 400,000 people ages 18 to 34 bought an insurance plan. Young adults represented 29% of all enrollees. That exceeded projections, and health exchange officials want to keep that kind of mix going.
Do you know if you need help signing up for health insurance in case you fall on that skateboard?
Near the SDSU Student Union building, Brittany Bloom hands out information about Covered California.
Do you all know if you need help signing up for health insurance? You two know if you need health insurance? Health insurance? Health insurance? Health insurance? Health insurance? Health insurance?
Thanks to a Covered California grant, campus coordinators like Bloom are on site at 12 of the largest Cal State schools. Bloom says it's hard for students to see the value of buying insurance.
Especially when you are young and think that you can rule the world and nothing will happen.
Bloom and her fellow coordinator, Kim Benzie, make presentations all over campus, but they usually don't draw much of a crowd. Still, if only one person shows up, they'll go through their spiel. They also pitch Covered California in classrooms, where they're guaranteed to have at least a few students in the audience. Bloom likes to mention the cost of monthly premiums.
So how much is it? Depending on your income, depending on the plan that you would like, it can be as low as $26, which is less expensive than many of our cell phone bills, hot date to the movies.
This presentation hits home. By the end, 7 students said they wanted information about signing up. Cal State officials estimate 10% of its students have no health insurance. Kenny Goldberg, KPBS News.